Good morning, everyone. Welcome. My name is Emily Corey-Pryor, and I'm Executive Director of TA4.12, which is committed to increasing the production and use of global gender data. And if we could, I don't know if it's possible to keep the lights a little bit up. I had asked that. You know, you get in this big room, in this big dark room, and you can't see anyone. So just want to make sure that everyone stays awake for what I think is going to be a really interesting panel. So on behalf of TA4.12 and our partners Open Data Watch and DevX, I am just thrilled to welcome you to this session on gender data impact and gender data impact stories. It's no secret, I think everyone in this room and everyone in lots of rooms and living rooms loves a good story. And at TA4.12, we've been working since 2013 to really advance the idea of the importance of gender data for good decision making. But what that means is sometimes is that you have to bring people along that train of thought. You have to help people understand why gender data is so important. And one extremely useful way to do that is by being able to trace having gender data and showing a story that results as a result of having that gender data. So how do we get from the production of gender data all the way through the chain to the use of that data and the really important impacts that it can occur when you have it. So even though we weren't hearing those stories, and we were having a lot of conversations where people would ask us, okay, I'm convinced about the importance of gender data, but can you tell me what happens if you don't have it? We thought, all right, we're sure that these stories of what happens when you do or when you don't have gender data exist somewhere, but they're not put together in any kind of cohesive framework. And so we set out with our partners Open Data Watch and DevX to do that. And earlier this year, we issued a call for gender data impact stories that went out to our community, and we pushed it out as far and wide as we could. And our goal was to find stories that demonstrated how collecting and using gender data could lead to better outcomes. We really just wanted to illustrate the case for why gender data is so important. And we wanted to do this not only for our own use as TA4.12 and Open Data Watch, but really for this overall community. So we want everyone who's in this room, everyone who's following this online, to really help us make that case. So in this morning's session, we are so excited to share several of the stories that were identified through this process. Our hope is that you will take these stories as an invitation in your own work to uncover even more stories. And you can reach out to us anytime with those stories. We would love to hear them and to share them. So with that, I am going to introduce you to my wonderful colleague and our dear friend, Shada Badi, who is Managing Director of Open Data Watch and also a Senior Advisor to TA4.12. She's going to explain the process that we use to identify stories that demonstrated gender data impact. Thanks, Shada.
Thanks, Emily. Can you hear me?
Get closer to the mic.
No?
Can you get a little closer?
I'm going to wait until, this one? Maybe I use this one. Can you hear me now? Yes? No? Yes? Better? Okay, good. Well, thanks, Emily. So I'll just take you very quickly through sort of the concept behind the data impact stories and what we set out to do. So can you see any slides? Yes? Good.
Oh, there.
All right. So one of the first things is I just wanted to tell you about was that when we started talking about, as Emily said, to talk about gender data and importance of gender data to be mainstream in all the different sorts of data activities and for it to be used and, for its outcome and impact to be expressed. Many people were asking us to sort of make examples and come up with cases of data impact stories. So we came up with this idea of going and collecting data impact stories. I have to tell you that I had no idea how difficult it is. So it's really a task that needs to be collectively put into action in many ways. So one of the things that we really learned from the data impact stories is that we have to have a sort of a concept behind it, and we have to have a framework. And the framework that we've been using for the data impact stories is what we summarize here in what we call the data value chain. which in fact has been very popular in many fronts, that people have really liked this because it really shows the journey that the data travels through from the time of the production all the way to publication and the uptake and use and impact of it. So we thought maybe we can use this as a way to guide us through the collection of data impact stories. And particularly for gender, as you know, gender is quite difficult to integrate into many of the existing or new data functions and data streams. So, keep in mind the data value chain, and we have more of this documented on the on Data2X and Open Data Watch website. And in fact, if you want to know more about it, we have at our booth, we have some information about the data value chain and also a big picture of it. So, keep that in mind for as we go forward. So, but then we also had to really unpack the data impact and what does data impact actually mean. And here are some of the definitions that we've used to also define it for ourselves, but also when we go out for challenges and when we go out for collecting stories. We're looking at data impact as being a change in policy or a change in a development partner funding, for example, a change in the way that major regional or national programs are being implemented. But also very important is for us, impact means change in people's behavior as a result of using data. So if you will, if a story or an impact story that we collect meets most of these, we call them gold star stories. But of course, there are not that many gold star stories, and I tell you a little bit about that. So we started, based on that concept and that idea, we started collecting the data impact stories, and one of the vehicles we used was going for a challenge. And of course, collecting between January last year and we gave 2 months for collecting data stories, and then we went through a very serious process of sort of going through these stories and selecting a few which really meet our gold star requirements, if you will. I just want to tell you that we had many stories in the path to impact. We learned through the process of going through challenge and through the collection of the stories that not all the stories are impact stories. So we had lots of stories, for example, at the collection. And they were very wonderful stories because we're going through a data revolution. So people were telling us, for example, they've come up with an innovative way of collecting data, and they are really excited about mainstreaming it and going forward. But we really didn't have the impact that would have. So we collected those stories, but they're not here today as impact stories. We had lots of stories at the publication, people who have done really good analysis and published their data. But again, it was not really clear what impact we had. So we were very tough on ourselves and also on our stories as to really draw out those stories that have impacts. And of course, getting closer to impact is when there were some stories that had uptake, and they showed that there is things that are being connected. They're getting closer from production to policy impact and use, but they were not yet there. So again, you don't see that many of them here. So finally, we get to stories of impact and stories where data has been used and has had an the outcome or tangible outcomes. And you're going to hear some of those stories today, but it's very important to keep in mind, and we're keeping in mind, the benefits of the data impact stories in these 4 areas. For strengthening, we want the data impact stories to really strengthen the call for improved gender data and making a case, and providing resources and advocacy, motivating policymakers and decision makers, and of course, through the journey, we also want to better understand the use impact cycle of gender data. So today you're going to hear 4 of the gold star stories, and they are here with us. And I'm just going to pass it on to Emily to maybe introduce our speakers. I won't say anything about the 4 stories, but I can't wait to hear them myself. Thank you very much.
Thank you so much, Shada, for taking us through the process of doing this. So it's really my pleasure to introduce, as Shada says, these gold star stories and our storytellers here with us today. And thank you all for being here. They have been asked, just so you know, to frame their remarks as stories instead of a typical conference presentation. So perhaps this will be a bit different than some of what we've seen so far. They've also been told that their PowerPoint presentations need to be image-based, so we will see if they read their instructions. But with no further ado, I'm going to introduce our 4 storytellers. So first we have Henrietta Jansen, who is Technical Advisor on Violence Against Women, Research and Data at UNFPA. We have Frederick Mukumbi, who is Uganda Principal Investigator for PMA 2020. We have Daniela Ligiero, who is CEO of Together for Girls. We have Mario Brun, who is Director General of Statistics Finland. And last, we have Rajesh Merchandani, who is Chief Communications Officer at the UN Foundation. So now we will hear from our first storyteller, Dr. Henrietta Jansen.
Good morning. Do you hear me? Yeah. I'm delighted to be here, and I think my slide is up, so that's nice. I just need to use the clicker. But I wish that my Vietnamese colleagues, Queen Anne and Na, could be here, but they are tied up with the follow-up survey to the Violence Against Women Prevalence Survey that I will talk about today. In 2005, I went to Vietnam for the first time, and that was when the Vietnamese government was drafting a law on domestic violence prevention and control. I was working at the time with the World Health Organization in Geneva, and the report of the WHO multi-country study showing comparative data on domestic violence from 10 diverse countries had just come out. I was invited to present to the Vietnam National Assembly data from these other countries to show that domestic violence exists everywhere, and thus showing that it's not shameful to do something about it. The Vietnam domestic violence law was adopted in 2007. At that time, very few people in the government or the general public believed that violence against women was an issue in the country. At the most, it was considered a family affair or a culturally sensitive issue. And despite this domestic violence law that they had, there was no national program or strategy. And that was still so in 2009, when the government started planning their first Violence Against Women survey with strong support from UN agencies, particularly WHO and UNFPA and the Millennium Development Goals Achievement Fund. They wanted to get a comprehensive picture of the situation in the country and to have a baseline to measure the impact of the domestic violence law. The survey was done under the UN Government of Vietnam Joint Program on Gender Equality, and I was hired to help planning and implementing the survey. Many international and national agencies were involved. We trained about 80 interviewers at an intensive 2-week training in Hanoi, and the interviewers had to interview 5,000 women in the entire country while keeping the women and themselves safe. Policymakers and other stakeholders were on board since day one. They helped plan the survey, adapt the questionnaire, discussed findings in workshops, and provided feedback at the various stages of the report writing. In November 2010, the results were launched, and the numbers were shocking for this country where violence against women was not known. 1 in 3 women reported being physically and/or sexually abused by husbands, and when combining with emotional violence, the proportion that reported experience of violence was much higher, 58%. The survey also showed that 50% of the survivors had never before told anyone, and 87% did not seek help. As mentioned, all relevant stakeholders were on board since the beginning to make sure that everybody understood how the data was collected and what it meant. But despite of this, the results were a hard pill to swallow. To give an example, 1 week after the results were launched, a national workshop was organized with 100 government and development partners to discuss evidence-based interventions to prevent and respond to domestic violence. At this workshop, a survivor of violence relayed her story of living with a violent husband during 20 years. The chair of the meeting, a high-level government official, angrily walked out of the workshop because he did not believe her and he did not accept that such a thing could happen in the country without the government knowing and without the government doing something about it. My UNFPA colleague, who co-chaired the workshop, she followed him. And on the corridor, she told him her own story of surviving spousal abuse. She had lived 8 years with a violent husband, and it took her all that time before she and her children dared to escape, and scared and worried about their safety and not knowing where to go. Her story showed him that violence could even happen to medical doctors like her. And she convinced him not to abandon the workshop, but to start doing something to stop domestic violence. And this touched his heart. So he came back to the workshop and just started the transformative journey of Vietnam. Fast forward 2018. What has happened is that the powerful partnership between data collectors and decision makers culminated in a national action plan and program of actions through 2020 to stop violence against women. And every year in June, massive awareness campaigns take place featuring speeches, parades, music videos, and create a conversation around a taboo topic. Counseling and medical support is incorporated in social work and health centers and is reaching thousands of violence survivors. Other support services include legal aid support under the Ministry of Justice and quick response teams in the police under the Ministry of Public Security. Community safe houses now shelter women who flee danger. The government has reviewed the 5-year implementation of the domestic violence law, and last year they included domestic violence in their revised legal aid law, which provides disadvantaged groups with free legal support, and importantly, women who live with violence now realize they are not alone and are not to blame, that a peaceful life is a human right. And this would not have happened without data. The Vietnam experience is now a model for Asia and the Pacific region. Government officials from other countries go on study tours to learn from Vietnam, not only to learn how the statistical office changed their way of working, but also to see that data can truly lead to impact, and when end users are included in the data collection process from the start. And now, 10 years later, 10 years after the first survey, Vietnam has just now taken the courageous step to do a second survey, and preparations are underway as we speak. And the difference this time around is that the government itself has initiated the survey, because they now recognize the problem and they recognize the value of data for measuring change and developing policies and programs to protect women from violence. Thank you.
Thank you so much, Henriette, for sharing that story. I think you can see why that was a gold star story, and we're excited to see, the results of this new survey. So now I'm going to turn to Dr. Frederick Makumbi from Uganda.
So thank you very much. Going forward. Okay, so this story again comes from Uganda, which is East Africa. And I'm part of a big team called Performance Monitoring and Accountability 2020, which focusing on providing data following the Family Planning 2020 in London commitments that governments made that needed to improve family planning uptake of services. We have what we would call a high fertility rate, which stands at something like 5.4 now. But the issue of the interesting matter is that they are under those averages, there are very strong variations. There are women who are in need of being, creating awareness and addressing their family planning needs in order to bear the children that they need and when they need them. Over there, there's a lady called Nabatan has shown who has over 30 children at the age of something like 38. And another one who delivered and is now a grandmother at the age of 27. So when we talk about family planning needs, when we talk about a need to improve service to those who need it, we have real women out there who need, and men who need these services. But unfortunately, the way we present our data, with the put on averages, and the real women are missed. Women spend a lot of time going out working, fetching water, doing household chores, and they never have opportunity to listen to health messages, to go to the health facilities in order for them to get the services that they need. So a lot of that time is spent without them having their challenges addressed. Ruth, one of the women who we have managed to talk to, is 26 years old. She has 4 children. At that age, she began childbearing very early. She talks to a friend, and she wants to start she wants to control the rate at which she's bearing children. Her friend advises her to visit the health facility to be advised and counseled to get family planning services because she needed them. She tries to get family planning. Her family planning methods were pills. First month, she's able to get those. She goes back the second time, she's able to get that. But afterwards, 3 consecutive times, she finds that the method of her choice is missing. 3 consecutive times. And as you see, some of the shelves are empty. And this is one of the service delivery points that we're able to visit during our study and able to capture lack of complete methods. But also, the services that are available are provided in settings where no quality services, especially counseling, can be offered, as seen there. Confidential quality services are offered. So these data that we collect are able to be able to speak to the challenges women face out there. So how do you collect the data? The Bureau of Statistics in Uganda, Statistical Office, collects a lot of data about family planning and many other services every 5 years, as in many other countries. The challenge is, if commitments are made the way they are made in Uganda, there's need to do continuous monitoring and evaluation to see how far the commitments, financial and otherwise, that are able to address the needs of the women. So with the PMA 2020, we're able to collect annual data. We're able to analyze it using data collected using electronic gadgets in order to speed up the collection, in order to speed up the analysis, and also in order to speed up the dissemination and sharing with the various stakeholders. So every year for the past 6 years, we have been able, past 4 years, we have been able to engage family planning providers. We have been able to engage government. We have been able to engage communities in sharing the information that we receive and even able to provide stories like indicated. And this has really been very helpful because as we share, as we share those data, some key findings have helped change the way service gets delivered. We know women, as indicated earlier, have a challenge of working in health facilities because they will find stock out. We know women have a challenge working in the facilities because they do not tell their spouses that they are interested or they would like to take up these services in order to minimize the risks of frequent childbearing. So what has this data helped to do that we collect? We've been able to discuss with implementers, and some of them have devised ways of strengthening delivery of these services into the communities. One of the most preferred method that women have taken up and is being provided one of the implementing partners is called the Sayana Press, which is self-administered, or a method which can be offered by the village health team members with minimal training. So women walking to the facility, in that case, is minimized, but also they get the method of preference they want, and also they can be visited in their homes frequently. But also the data that we provide, plus other data that are already in the country, have strengthened the need to bring together the adolescents who have been the highest at risk of having unintended pregnancies. They have been able to train them in a way how they could delay childbearing, delay sex debut, but also get enrolled and stay in school, as some of those pictures show. So these data have been used to together work with the implementing partners to be able to provide, as indicated, services to the communities directly that has strengthened the delivery system justification. Adolescents have been brought together in these settings, and they are being talked to, and many of them are beginning to appreciate and understand why they should be staying in school, why they should be busy, and why they should delay childbearing. But also, interestingly, other partners have said, because family planning is not only about use of contraceptives, there are issues of desire for high number of children and other social cultural barriers, and also men involvement. What has now also been done is for these implementing partners to ask my team to help them identify what I would call hotspot for very high family planning and fertility needs in the country, so that these different teams can be able to construct relevant interventions in the communities. And so these data that we provide have been working well, and our hope is that in the end of the day, with men involved as well, we shall be able to see happy families with women and men bearing children that they can afford. And we have been seeing an interestingly declining total fertility rate, but also the targeting of women and men who need the services in order to better control the family sizes of their families. Thank you very much.
Thank you so much, Frederick, for highlighting the importance that this is not only about people's health or various forms of development, but also about their happiness within their community. So I think that's really incredibly important. So now I will turn it to Dr. Daniela Ligiero from Together for Girls.
Thank you so much. I love how you're getting my name right. It's so rare. Hello, everyone. It's been said sometimes that reality is way too complex, but that stories help give it form. And so I want to tell you a story about how data can change a young life, and in fact, the trajectory of an entire country. Is there a clicker? Next slide. Oh. Maybe not.
There.
Yeah, okay. So these are two 15-year-old girls. On the left hand, you have Beata, who lives near Dar es Salaam in Tanzania. And on the right, you have Audrey, who grew up in a very affluent neighborhood in Northern California. From most perspectives, the lives of these two girls are very, very different. But unfortunately, they have a common component, a common experience that unites them, like it unites so many girls and women and children around the world. They both experience sexual violence. Beata was raped by an older man in her neighborhood, became pregnant as a result, was forced to marry this man, had the child, and dropped out of school. And so this experience has altered her life forever. Audrey was raped at a high school party. Someone put something in her drink, and the rape was captured on social media, put online, and she experienced months of online bullying until it got to a point where she could no longer take it, and she actually took her own life. She's now part of a Netflix special that just came out on sexual violence in adolescence. And these are horrible, tragic stories, but they illustrate a reality that is all too true in every single country in the world. The problem is that these stories are hidden. We don't hear them. In fact, we believe that violence against women, children, girls, especially sexual violence, is the single largest hidden epidemic of our time. And that's why we believe that in order to solve this problem, first, you need to show it exists. You need to uncover it. You need to show the magnitude of the problem. And so at Together for Girls, we believe that that must start with data. And so data is the first pillar of our model. The other thing we believe is that a problem of this magnitude cannot be solved by a single actor or a single sector alone. It must be done in partnership. So a little under 10 years ago, we were launched as a public-private partnership, and we decided to test this model of using data and evidence as a starting point to action and advocacy in a handful of countries. And to date, we're actually working in 22 countries now, and we have data for 10% of the world's population under 25 on issues of violence, including physical, sexual, and emotional violence. But I want to talk a little bit about Tanzania today, actually, because Tanzania was one of the first countries where we implemented this model. And what we do is we start with a national household survey that interviews 13 to 24-year-olds and really gives a lot of deep, granular information around sexual, physical, emotional violence, perpetrators, times of day, locations, risk factors, protective factors, consequences. So it's a very deep look at these issues, but it allows you to get nationally representative data. And Tanzania was one of the first countries to do this. They took the bold step of deciding to do this violence against children survey in 2010. And one of the requirements we have is that when governments, first of all, governments have to require the survey. They have to say they're going to do it. They have to lead it. They have to identify a national organization that's going to implement it. The survey is led by CDC and UNICEF as part of the Together for Girls partnership with support from many other partners. But most importantly, governments need to commit to bringing together this multi-sectoral task force that includes representation from civil society, multiple sectors in government, as well as multilaterals and other actors to actually use the data to develop a national action plan. So it's not just a survey sitting on a shelf. Tanzania actually did the survey and launched the reports in 2011. By 2013, they had developed the first ever national action plan to prevent and respond to violence against children. That plan was a 3-year plan, and it was updated in 2016, and the newer version is now being implemented. And I want to tell you a little bit about what the survey found and what the results were of the actual national action plan. We found that in Tanzania, 27% of girls and 11% of boys experienced sexual violence under the age of 18. This is nationally representative data. 31% of the girls who experienced sexual violence became pregnant as a result. Unlike what most people thought, again, this is a hidden epidemic, 1/3 of the perpetrators were strangers, but 2/3, the vast majority, were someone known to the victim. In fact, neighbors, boyfriends, and friends or peers were the top 3 perpetrators. Half of all incidents happen in a home, either the victim's home or someone they know. And school was actually one of the safest places for children. Going to and from school was much more dangerous. Like what we heard from Vietnam, only half of all the victims ever tell someone about that experience. Again, it's a silent epidemic. And of those who tell, less than 10% received any kind of services. These data shocked the country, shocked the Tanzanian government at the time when they came out. But over the last decade, the government has made commitments to respond to these data and to create a difference in the lives of millions of children. I want to give you some examples. One example is PEPFAR, the HIV program that the US government has. They've spent over $100 million in the last several years preventing gender-based violence with a particular focus on adolescent girls through their DREAMS programs. And one of the things they do is they empower young women and adolescent girls at risk within their communities so that they can become HIV-free by making sure they're educated, empowered, and safe. So safety is a really important component of this. Another thing that's happened is Tanzania, they had none of this before, has developed a program called Gender and Children's Police Tests, led by the government, where they train police officers, judges, lawyers to actually respond to victims as they come forth. Today, 24 local districts have gender and police tests. Thousands have been trained, and every time one of these gender and police tests is set up, reporting rates rise through the roof, and we've seen an increase, a significant increase in conviction rates that didn't exist before. Again, I'm giving you just a snapshot of some of the results that we found. Child protection systems. As a result of the survey and the national implementation of the action plan, 47 local government authorities now have multidisciplinary child protection teams. In addition, most districts in Tanzania now have what they call one-stop shop centers, where people who have experienced violence can come and receive a variety of different services: health, police, social services, legal services, all in one place. And again, most districts now have these. Just in the last few years, over 6,000 healthcare workers, police workers, and social service workers have been trained. And just in the last 2 years, over 1 million children, almost 1 million children, have been reached with services. Again, this in a country where before none of this existed. And so I think the reality is that Tanzania was able to show us that it is possible, when there's government commitment and good data to guide the way, to implement services at scale. There's still a lot to be done in Tanzania, but in the last decade, they have become what's known as a global pathfinder for dealing with issues of preventing and responding to violence against children, adolescents, and youth. Change is possible if there is commitment. Eleanor Roosevelt, who was a US First Lady, once said that the future belongs to those who believe in the power of their dreams, but I believe that we can only achieve those dreams if we have good data to guide the way. So thank you very much.
Thank you, Daniela. Thank you so much. And I think this is also a really important reminder that even though I think sometimes in the data world there can be a feeling that, well, data that are on difficult topics are somehow, harder to collect. And while they might be harder to collect, I think that we also see that if you do make the commitment to collect those data, it can really result in some positive policy change. So thank you for that story. I'm very happy to have Mario Brun from Statistics Finland speak next.
Thank you. Very happy to be here. To begin with, I want to congratulate the organizers, and I want to congratulate everybody who's in here, because we are talking about what statistics and data can do. The other sessions are talking much about, is there any value, how can we get any investment, how to collect data. I think this type of sessions there should be more, to show that it is valuable, it has value. Anyhow, my story comes from Finland, and from some time ago, in the 1990s. First, a few words about Finland. Finland is a very northern country in Europe, a very large country with a very sparse population, about 5+ million people. So in the early 90s or late 80s, we had a wave of urbanization again. So the countryside was becoming sort of empty. And it was noticed that there's more men and women are moving out. So this was the problem, what is happening and is it happening? We did not collect special data for this since we have plenty of data. This is about a reuse of data. We had 2 time use surveys from the late 70s and late 80s, and to compare those, you had to understand what is happening in the rural area. We had to use the population registry. We can combine all data because we have personal IDs, and that population registry told where the people in the time use survey come from. So we could see what is happening in the rural area between men and women, how they spend their time, and also compared to town and city areas. And it was noticed that the life of women in the rural areas is quite different from their sisters in the towns. They spend more time at work. They typically work in the farm, which is typical, I think, all over the world, 7 days a week, plus household work, much more than their counterparts in the cities. Also, they had much less social involvement because living in a very remote area, they didn't have a chance to meet friends and things like this. When compared to men, men worked almost like they had an opportunity to work at their place or in a workplace, and they had social relations just as the men in the cities and towns. So there was a project, and this was the outcome from the data. Well, when you have the data and you can show this is what is going on, it became public. And it was in a very good coverage in different media, and then what to do. The government was asked what is going to do, because of course it's 2 problems. There's women who are sort of working too much and getting tired, and then there's men who end up being by themselves in the countryside, because although women wanted to move to cities, life is better. Then, of course, in the cities, they couldn't find husbands so easily because they were overpopulating by women. So there was rural programs, investment put into both governmental and municipal program for women to have them sort of activated, how to earn money, do some job opportunities, how to meet each other, and so really it affected. And I recall this time also myself in the agricultural show in the early 19s. There was the first dating program introduced where you could look for a spouse, because this was the big problem for the men in the rural areas, since there was hardly any women. And then nowadays we have even TV shows how the men in the countryside could find a wife. So the dating program. So it has affected, and it became public. And this is, I think, a big thing of usage of statistics. So we always say statistics is not ready until it is used. And this is, I think, very good stories, by the way, and so happy to hear them. Thank you.
Thank you for that story, Mario, and it's so helpful, I think, to also hear about the interaction of different aspects of people's lives, right? So economic opportunities, the way that time is used, hearing a bit about the work, both paid and unpaid, that occurs within communities, and the interaction that has with relationships and with marital relationships as well. I didn't know we were going to have a dating conversation, but you never know what's going to happen at the World Data Forum. So I'm now delighted to turn to Rajesh Mirchandani, who's Chief Communications Officer at the UN Foundation, but he's also a former BBC correspondent and news anchor. And I want to turn to him for some reflections on the stories we've heard and why these stories are really so critical in our effort to make the case for gender data and why it matters.
Emily, thank you very much. Panelists, thank you very much for your wisdom and your stories. Ladies and gentlemen, it's great to be here. I know there are some journalists in the room, so I hope you've been taking lots of notes about the stories that you've heard, because I would love for you to tell these stories more widely. So both with my communications hat and my journalist hat on, I think what all these stories have done is show the critical relationship between the human story and the data. The data that shows a broader issue. Alone, the human story is an anecdote that you or I might discuss, that if it was local to a specific village, that neighbors might discuss, oh, do you hear about the woman down the street? And that's of interest. But to really make policymakers sit up and take notice, to make the media take notice, we need the data as well that makes us understand that that human story is an example of a wider issue or a wider problem. And that's the way that we can actually drive change. It's the data value chain that Shaida, you were talking about, which is a really interesting graphic that starts with collection of data, but really pulls out. It's imperative to pull out the human stories at the heart of the data, because data is not about numbers, data is about people. And I think that's what we really have to remember. And so I think all these stories have done a really good job of doing that. But let's just be, given we've talked about dating shows, let's talk about talent contests, and let's give a little bit of judgment here on all the examples that we've heard. So Henrietta, your story in Vietnam, I think a really interesting element of that story was that it was the statistics that got the minister into the room, but actually it was the human stories that minister heard at that session that got the minister back into the room, and that actually led to the government embracing and owning the policy change agenda that came from that. I thought that was really, really fascinating. I really want to know what the results of the second survey are, because it's one thing to talk about, and I think this is a slightly different tack when you're talking about data impact storytelling for funders versus data impact storytelling in the media or for policymakers. It's one thing to talk about the outputs of the work, but I think we need to know about the outcomes, the greater outcomes of the work. Frederick, your story in Uganda, I've actually heard this before, and at another data event earlier in the year organized by one of my colleagues at the Global Partnership for Sustainable Development Data. It's a really great example. What I really think is exceptional and demonstrable in this example is the way that you've told the story of how electronic collection of annual data aggregates learning experience into national statistics and learning that then informs policy. It's a circular motion, and I think you showed it with one of your slides, which was really fascinating. At the same time, because you are drawing national level learning from local examples, you're respecting cultural realities and cultural traditions in your work, and you're creating solutions that work for women in their communities. Emily, I think you described it well as health and happiness for women in those communities. I think that was really, really interesting. And then you also demonstrate how the national level learning filters down again to local level implementation, of having implementers now offer at-home services for women. So that's a really great example of using technology as well to amplify human stories, turn it into national level learning, and then use that for local level implementation and policy change. Again, I would like to hear, and the same with the Vietnam story, I'd like to hear from some of the women who have been impacted. Now, because of privacy issues, cultural issues, again, you could do that anonymously, but I want to hear that personal story again. It's great that the human stories and the personal stories have been used to inform policy, but I want to hear what those stories, what those outcomes were for the women on the ground. Daniela, presentation-wise, you started off with two really strong human stories that connected people from different walks of life and showed that sexual violence is an issue that does not respect geographical, racial, ethnic, or socioeconomic boundaries. It affects women everywhere. The amazing thing that happened was that there was a government survey that revealed the widespread nature of sexual violence. It led to the training of police officers, and the reporting rates went up and conviction rates were up. That's the outcome, which is a really crucial part of telling the story. I think we'd all agree that the next step is there a secondary use or another use for this data so that rather than just convict men of crimes, we can actually educate men that it's not okay to do this in the first place. I wonder if the data could be used for that as well. Maybe that's a secondary impact. She's saying it actually is, but you didn't have time in your stories. That's great to hear. Mario, I love the story of collecting data, widespread data collection and direct policy implications. I mean, it's very clear correlation there, leading to a dating show. I mean, who doesn't love a dating show? You know? That's a great story there. So I think all these stories have all the elements. Just as a storyteller, there's a couple of hopefully tips that I hope I've given you. But again, what they underline is the critical relationship between the human story and the data that's describing a broader story, but allowing us to have policymakers sit up and pay attention. Thank you.
Thank you so much, Rajesh, for that summation. That was impressive. That real-time summation, that's not easy to do. So thank you so much for that and those reflections, and hopefully those are helpful to our storytellers, but also to others in the room. So as I said at the outset, the call for stories, it happened earlier this year, but it is not done, right? This is an ongoing process, and really want to encourage and ask for your help, and this is an action session. So we want to ask for your help to continue to identify and document and share these stories. And I actually have our colleague here, Nina Rabinovich-Blecker, who's Director of Communications for Data2X, and she's worked incredibly hard on this process, along with Sheda Badi from Open Data Watch and Deirdre Apple from Open Data Watch, and our partners at DevX to help identify these stories and then share them out. But I'm going to ask Nina to just give a few quick tips on how to do this.
Thank you. Thank you. And is someone have a clicker? I just have 2 slides. Great. Thank you so much. And thank you so much to all of our storytellers. You know, it's for people who typically might give more academic presentations, to ask them to come up on the stage and to try to make their presentation in a story format can be somewhat scary. So thank you, all of you. You did a really great job, and we're really grateful to you. So as Emily said, these 4 stories that you've just heard really just scratch the surface of what's available, we believe, out there in terms of gender data leading to impact and good stories. But we really need your help to collect more stories. And this is really important for all the reasons that you've heard. These stories will help make things that can feel inaccessible accessible. They can help translate complex concepts for different audiences. They're really important tools for advocacy and for reaching different stakeholders, especially stakeholders who aren't here at the World Data Forum, but who we really need to be able to reach. So obviously, I'm not going to teach everybody here in this room right now how to write a good story, but I wanted to just offer a few pointers, very much building on what Rajesh just shared. And I'm happy to obviously talk with you afterwards at the Data2X exhibition booth and beyond. Do I just push this? What do I push? There we go. So I've broken this down just very briefly into a couple of key elements to be considering for all of you out there who are going to go back through your work and think about where you might have examples of gender data and other data leading to impact. So the first thing to think about is to think about what the focus is going to be of your story. The stories need to be about a change that occurred. In the case of data storytelling, it needs to be a change that's occurred because of the data. So the story is not just that there is data. The story is not, unfortunately, just that one individual was helped. We need stories about broad-scale impact where data was the driver. So once you sort of have this big picture plan for your story and you know what your focus is, you need to script your plot. And I mean this really literally. You should treat your data impact story no differently than you would treat a fictional short story or a script for a television series. We want there to be a narrative arc with a beginning, a middle, and an end. You can start by setting the scene. What was the situation that existed in your country or in your sector before this story even takes place? Next, think about sort of the growing action, the excitement. Why was data collected? Who led the collection? What was expected before this data was collected? And how did the process take place? Finally, as all good stories, it needs to build up to a climax. And a climax in the context of data might seem strange, but we're talking about, what did the data find? Was this surprising? How is this somehow exciting, different, and changing expectations? And finally, the happy ending. What happened because of the data? How did things change for the target population? And, I say happy in quotes because it doesn't necessarily have to be an actual happy ending. There needs to be an ending, but there might be cases where data collection processes were undertaken and a positive impact didn't occur, but there still could be shared learnings that would be very important for our community. So once you have this all sort of drawn out, you might think your story is finished, but no. As Rajesh pointed out really well, for these stories to really work as stories, we need a hook. So is that going to be a human interest lead? Who are the main and supporting characters for your story? This can be a challenge in the case of data impact stories because, again, we want to look beyond just the individual narrative, but we could focus on how the data collection process impacted an entire group of people, like women experiencing domestic violence, sexual violence, as we've heard about, child care, realignment, as we heard in Finland, et cetera. So we need to find a way to kind of create a hook to get people excited about the story. And finally, we need to close with a moral. Now, data stories aren't children's bedtime stories. We're not talking here, slow and steady wins the race. We're not talking never cry wolf. But for these stories to be successful and for them really to drive impact, to demonstrate impact, but also drive impact and inspire action from our audiences, we need to be able to close with some key takeaways or calls to action, because this is how we really will have this story then lead to advocacy. So, as Emily said, I'm really happy to share that Data2X and Open Data Watch's effort to collect gender data impact stories is not done. We want this to be an ongoing process. We have a portal for story submissions. It's open. You can see the URL up there. We also have some cards that we're handing out at both of our booths, and be sharing it all online as well. Our goal is to create a repository of stories that can be used by our community to support everything that you're doing, whether it's reports to policymakers, pitches to journalists, talking points for speeches, et cetera. We think that these stories are critical pieces that we all can use in our work. We want to collect these, and then we want to put them out there for all of you. We'll be launching a new website in the coming months that will house the stories that you've just heard and other stories that are submitted. And we look forward to being able to share your stories as well. So please help us submit stories and help build the case for why gender data is so important. Thank you.
Thank you so much, Nina, for really getting down to the practical aspects of doing this. So now I'm going to turn it to our audience. We would love to welcome some questions, and hopefully we have some answers. And I think I see a woman right here in the middle, and we'll take a few questions and then go. So in the gray, yes. Thank you. And there's a microphone on its way. And if you could introduce yourself and where you're from, that'd be great.
Hi, my name is Sarah Long. I'm with the World Justice Project based in Washington, D.C. I have two questions. The first is for Dr. Leggero. At the World Justice Project, we run household surveys in 125 countries to understand how the rule of law is experienced by ordinary people. And some of those questions cover issues such as being threatened or harassed or experiencing family disputes, including gender-based violence. And one of the things that we struggle with is what we think is, underreporting of some of these sensitive issues. So I was wondering if you could maybe provide any insights on either how the surveys were drafted or interviewers were trained or selected to solicit honest answers to some of these really sensitive questions. And then a second question for really any of the panelists is, So 2 years ago, the Governance Data Alliance produced a report showing that one of the really biggest issues with the use of governance data was a mismatch between the supply of data and the demand for this data. So one of the things I was interested to hear more about was what got the decision makers either interested in conducting these studies from the outset and or what got them in the room once the data was made available? What was the incentive? Was it public pressure? Was it tied to funding or technical assistance or something else? Thank you.
Great, thank you. And I saw a question next to her, and then a couple up front.
Hello, my name is Ritika Tripp. I'm a professor at the University of Oxford. And I have a sort of general question for the panelists. These are really interesting and exciting stories. I'm wondering what advice you have for academics who work with data and analyze data, such as myself, but often we don't think very much about impact. We are just used to putting our work out there in the form of peer-reviewed findings, and hope perhaps that policymakers might read it, but often that's not the case. Only our peers do. So how can we bridge that connection?
Thank you. And I saw another one up front. Okay, yes, the lady right here in the peach jacket. Thank you.
Hi, my name is Abella. I'm from Tanzania, so thank you so much, Daniela, for that story. I think my question is actually, I'm a youth mentor and I also work with young girls. My question is the participatory approach when you collect data, because at the end of the day, if you have such data that is actually government-owned with big institutions, how do you trickle it down for the usage to the girls and youth? How do you encourage ownership? And then they become the ambassadors of data, because I want to use that, but I wonder how much girls were involved and how much are they considering this is their data and they've been spoken for and it matters to them.
Great, thank you for that. I want to make sure I'm looking on the other sides. I saw a lot in the middle. We can take one more question and then we'll do a round. Was there any? No, I didn't miss any hands. Okay, great. Just shout if I did miss you. So with that, I think, Daniela, there was a couple of questions that were aimed kind of in your direction, and then for some of the other questions, I'll turn to the rest of the panelists.
That's great. I'll just answer the two that were for me, and I'll let others answer the rest. So starting with the issue of underreporting, absolutely critical issue. We've spent a lot of time when we developed the survey. Again, this is a new survey. It's only been around for 9 years now with UNICEF and CDC and other expert partners. There's a lot of training that goes in terms of making sure that there's report that's established. We're interviewing minors. We start at the age of 13. Which is an issue, and so making sure a lot of ethical considerations are put into place. Report, the way you ask the questions and the way you stage them. I mean, you can't ask someone, did you experience sexual violence? You have to start with all kinds of other questions and slowly get into the acts themselves so that you get much higher levels of reporting. We really learned a lot from the vast literature on violence against women and all the learnings there and applied that to the surveys, and we found that we actually have had the highest levels of reporting on these issues than any other survey. So I'm happy to share with you, we actually have a whole publication that's called Lessons Learned from the VACs that I can share with you around how to conduct the survey and reporting, but a very important question. On Tanzania and data ownership, I mean, you saw in my timeline that the government decided to actually do the survey in 2008, and the results were launched in 2011. The data was collected in 2010. We, as a partnership, again, really place a lot of importance on having the government decide to do this, request the survey, lead the implementation, and to have a local organization who implements the survey. We provide the technical assistance and the guidance. When governments request the survey, there are a couple of things they have to commit to. In addition to that national action plan I talked about and kind of, launching the report as a Tanzania report. So when you go look for this isn't the Together for Girls survey. It is the Tanzanian government's survey of violence against children and youth. So that's really critical for us. But also they have to make a commitment that after 2 years, the data becomes public. So these are public data sets now that we have for Tanzania, as well as for 12 other countries now, where anyone can access those data to do analyses, whether you're in academia or civil society. So we've done a lot of work. It takes time, it takes effort. It's not as quick as having someone come in, do a survey, and come out. But we believe that all of this is worth it, because at the end of the day, if the data doesn't really belong to the government, and if they don't feel ownership, they're not going to act on it. And that's the single most important thing around collecting these data. Thanks.
Thank you, Daniela. And just an observation that our clock up here says we still have 10 minutes, but my clock on my phone says it's getting close to noon. So I want to be aware and sensitive, to everyone's break. So just to say what I think I'm going to ask the rest of the panelists to do, I thought there was a fantastic question on supply and demand of data. And so, if you could talk a bit in your kind of closing 1 minute or so around what you're seeing in terms of supply and demand, and what are the incentives that really work, that would be excellent. And then maybe I'll turn over to this end of the panel to talk about any advice you have for academics who want to share findings. So, okay, Shada, do you have anything to say before on that topic before turning to?
You want me to?
Yeah. Everybody 30 seconds, maybe not 1 minute.
So,
Speed round.
I think the question on the supply and demand was really spot on, and we see more that there are lots of data that hasn't been used, and we have to really pay much more attention to bridging that gap between the supply and demand. But we also see the data that's being used is the type of data that actually responds to the demand. So it comes from the user-centric design point of view. But also is the data that's open, is the data that's sort of trusted from the source. So there's a lot, and is packed in the data value chain that shows that to bring the data for users, you really need to go through this value chain in terms of analysis, in terms of explaining it, metadata, and so on. So there's a data discipline behind that. One quick response on the very good question on the academics and how can they actually bring out some of the value of the data work that they're doing. Two quick response to that. One is, please make your data available and bring it out. So lots of academic work does not have the data published. So bring that data out, and maybe the rest of us can work with it, even if you don't have time and you're moving on to your next research project. The second thing is to maybe partner. If you're coming out with some really important issues, partner with others who can bring out those results. And CSOs, civil societies like Data2X and others are great for bringing those stories and those data to, and maybe we can work from there. So those are I have more to say, but I'll stop there. Thanks.
I think everyone has more to say on this. Thanks. Henrietta.
Okay. I'll just add a little bit to what you said, partner with others. When we speak about academics, there is one thing that I see is that academics often use data that's been collected in middle-income, low-income countries, and I only see their own clan as the authors. And I think if we look at ethical authorship, if you have been working with partners on the ground, include them. They don't need to be your co-writers, but they have been helping you with collecting data and so on. And I do think that we should be as inclusive as possible to include people from the countries where you work as an academic, to include them as your co-authors. The other thing that I wanted to say a little bit more on what Daniela said, collecting data on sensitive hidden issues is not business as usual. And I have a session on that also this afternoon that is purely around the training program that I lead a project that's called No Violence Against Women Data. That means you have to know the data to eliminate violence against women. That project is about capacity building on collecting data on violence against women. And we could include children, but we focus on violence against women. And to properly collect data, you need to involve those stakeholders in board, not only to use the data later on, but also in the process of data collection, because you need to keep your interviewers safe, you need to keep your respondents safe, you need to have support mechanisms in place, which you never do in other surveys. If women are in danger, you need to have something to offer. And I can tell you a horrible story. Just happened last week in one of the countries where a survey is taking place. A woman was killed in the community where the survey took place. And we are still investigating if that is related to the survey activities. But really, the confidentiality, the support, the issues on how you collect data, that's very complex. And it's not, you should not collect data for the sake of the data if you cannot assure that women remain safe because of the process of data collection.
Thank you.
Yeah, I have one more point, but
Okay.
if there's no time, could I?
I just want to make sure that our other speakers have a chance to just wrap up very quickly.
Yeah.
Yeah. We can talk after. There's a lot
Okay.
of passion here.
Okay.
Let me
Yeah.
make sure, though. Thanks, Henrietta. Frederick.
So thank you very much. Quickly on the issue of supply and demand, I think, given my previous experience, I think we need to create interest by ensuring quality data have been collected. Then people can have confidence in what we are communicating. But also importantly, certainly, we need to make sure, as my colleague has said, engaging the appropriate stakeholders from the beginning and throughout the process. But the other thing I encountered during this discussion when I had been asked to make this presentation was the presentation style was different. And I thought, on the other hand, it was more relevant and important. My background is statistics. I'm used to giving figures, but I said, wait a minute. I need to improve and communicate differently if the stakeholders are going to appreciate what I'm doing, and then they may demand more. Otherwise, if I do it in a complicated manner, then it's going to become very hard. So we need to revise and improve on our communication. That way, I think we can create even more demand. So those are my quick summary points.
That's great. Thank you for that. Mario?
I wanted sort of to answer the academia question, because the same question we have with statistics. My answer sort of goes to media, because statistical offices are not telling personal stories. That is not part of our profession to bring in the people, because it's just data that we sort of supply. But if you can engage the media and with a personal story, this is, I think, what I liked in my colleagues' stories, a personal story. This is very good. We, the academia and the statisticians, we like to talk how we did it and what we did, but that does not interest. It is the result that is interesting.
Thank you. Thank you.
Let me just echo that point. And to the Oxford University professor, firstly, thank you for wanting your research to be read by more than just your small peer group. Many of your peers don't share that enlightened view. I'm a little bit radical in this, in that your comms people can help you do this. Your comms people would never tell you what to write in your report because you're the expert. Similarly, you're not the expert on communications. Let them do their job. I am the firm believer that there is no story that cannot be told in 3 sentences. And your research, even though it may contain more Latin terms and more Greek numerals than English, for example, if that's your language of writing, because it's full of econometrics, you're still telling a story. And the story is not your methodology, your caveats, and your assumptions, or a literature review. Your story is, this is the problem, this is what I did, this is what I found, and so what? And so your comms people should be able to help you tell that story, so you should let them do their job. At the same time, make connections with media, and also read something about something called fluency theory, which says that your audiences are likely, basically says your audiences are likely to be more empathetic to what you're saying if you couch it in plain language. End of lecture.
Thanks. Well, as a comms person, obviously I appreciate what Rajesh just said, but I would actually say that I think that what we were trying to do with this session and with this whole project that we've undertaken is to start creating a culture of storytelling within the data world, within the data community. I think that there is more of a culture of storytelling around some of the other sort of spheres of development. And in the data world, there's been less of it. But there's no reason why there shouldn't be, because there are amazing stories out there. So whether you're partnering with the media or turning to your comms folks, or frankly yourselves, just thinking a little bit more about the work you're doing and how you can tell the story of what you're doing and help make it interesting and make it into sort of a broader advocacy tool. I think we can all work together to create this culture of storytelling right here within the data world.
No, I agree, and one just quick response to what Mario said about, it's not the job of a statistics office to be communicators. I would say that actually, Mario, she's the Director General of a statistics office. You're an incredible storyteller and communicator, actually, and I think that we all, those of us who are in the data and statistics community, can start thinking about ourselves. Yes, it's not your primary occupation, but you are incredibly passionate about what you do, and you can tell that story, and to use that to convince people to pay attention to what you're doing. So. It's good practice with this type of thing to end with a call to action. So I would say, listen in the hallways. If you're hearing interesting stories of data leading to impact, share them with us, particularly gender data leading to impact. But share those stories with us, with each other. I think that we just have to kind of create more of that culture, as Nina said. I would also say, given the region that we're in, we did not get a lot of stories from this region. And I would love to see more stories of gender data leading to impact from this region. So really would put that call out to our colleagues who work here as well. So thank you so much to our panelists for your storytelling, to all of you for your time and attention, and hopefully for your action. Thanks.